Hello, welcome to yet another video of Acharnidhan Academy. In this video, we are going to discuss the relation between Vyayama and its effects on Abhyantara Rogamarga. In other words, the exercise and its effects on alimentary canal. Before going to the description, so let us know about some of the concepts as usual. First, if you know about the physics, chemistry, and biology, and Ayurveda fundamentals, then any of the information that is being explained in Ayurveda that can be learned with the deepest understanding. Second, if you know about the whenever if you want to have the deepest understanding, we have to practice the concept of minimalism. Minimalism refers to one small the topic. We have to fetch the knowledge from multiple angles. Suppose in this particular example, Rogamarga itself. So, from the Ayurveda point of view, from the what do you say that the Western physiology point of view, pathology point of view, treatment point of view, and Panchakarma point of view, Roganidana point of view, Sharirikriya point of view. So, like that, multiple angles. So, discuss or they think about the particular concept Rogamarga. Then we can have a deepest understanding. Third point. If you know about the concepts of Kriya Sharira from each and every corner, then learning and or practicing the Roganidhan is not at all a difficult thing. It's very easy. And if you know about each and every corner of Roganidhana, then practicing Kaya Chikitsa or knowing Kaya Chikitsa is not at all a difficult. It's very easy, right? The same thing is being explained in the Western medicine. If you want to, if you are knowing the physiology well, then pathology we can able to learn very nicely. If you know about each and every corner of pathology, then practicing medicine is not at all difficult thing. It's very easy. The fourth, they which are considered to be the major motto of Acharya Nidan Academy. So that means whatever may be the information, try to look into the pattern. So this particular pattern means nothing but a repeated observations. So this can happen not only in the field of Ayurveda or any field we can able to apply. Whenever if you are learning any new informations, that means that has to formalized. That means whatever knowledge you are going to gain, make it in the formula. If you are able to make that particular formula, then the any kind of the link which is being delinked, that can be very well identified. For example, if a person is consuming the sour buttermilk continuously for a period of 15 to 20 days, then that is considered to be responsible for the increase of pitta dosha in the body. If little bit salt is being added, that is responsible for the pitta dosha increase even to a higher extent. Along with that, if the green chili is also being added, then there will be the vitiation of pitta dosha or abnormal increase of pitta dosha will be to the maximum extent. So that means this is about the pattern identification, so that what could be you can able to modify it. So that means whenever if you are getting increase of pitta dosha in the body, first and foremost measure you have to take, that is to reduce pitta dosha in the body. Whenever if there is a reduction in the pitta dosha, naturally whatever the symptoms that is usually manifest because of the pitta dosha, that is going to get reduced. Instead, if you want to have a speedier recovery, then we have to again some pattern creation should be there. That means we are going, instead of consuming buttermilk, sour buttermilk, we are going to consume the buttermilk which is freshly prepared without adding salt or green chili. Plus, if we take simple milk, warm milk, definitely so that will be resulting in the reduction in the pitta dosha in the body. This is about the pattern identification, modification, and creation, which are the major motto of Acharya Nidan Academy. And no compromise will be taken while learning any of the concepts in Ayurveda. Then, Next thing, so that is gathering the information in the both Ayurveda and Western information. When you think about Ayurveda information, so concentrate on the Ayurveda information itself. Think and think over Ayurveda information. What could be the next step? Next step. In that way, look into that. And similarly, learn Western information or the modern medicine information in the same way. At different intervals, try to bridge the gap between the two. If you are able to relate it at different intervals between the two, then that can be possible. We can say that we are moving in the right direction. So that means, so you have to practice or learn the Ayurveda just like learning a new language. So that means more frequently used words, try to uh, give a solution for those more frequently used words. Then go for the less frequent words, less frequent words, less frequent words. So that's how we can able to learn like a new language. Okay. The next, regarding the Abhyantara Rogamarga. So what actually this is being Abhyantara Rogamarga as such, that is being explained in my first video. So the Abhyantara Rogamarga is nothing but a Mahasrotas. Ayurveda says Mahasrotas is nothing but a alimentary canal. Why this is considered Abhyantara Rogamarga? This is the area where the disease start manifesting. Most of the diseases, they are considered to be happening because of abnormal digestive fire. This abnormal digestive fire may happen in an individual or may occur in an individual because of abnormal diet pattern, such as frequent consumption of food, which is being considered as adhyashana, and the abnormal quantity of food consumption and abnormal timing of food consumption, which is being termed as vishamashana, etc. So they are the probable risk factors for the abnormal digestive fire. So that means which is responsible for the poor digestion and poor absorption and assimilation. So in which in turn is moving responsible for the abnormal movement of these intermediate molecules into the periphery. So now, what actually Vyayama refers to? Vyayama is nothing but an exercise. If you do the exercise for a certain time period, so that means the person should not feel fatigue, then it is normal. So which in turn is responsible for the following mechanisms. First and foremost, there will be carbohydrate loss. Within a matter of 30 minutes, the person may have carbohydrate loss, which will be followed by mobilization of fat from the adipose tissue to the mobilization into the blood circulation. So, which is leading to the formation of ketoacidosis in the body. Right. Afterwards, as the Vyayama or exercise is leading to overactivity of skeletal muscles, smooth muscles, and cardiac muscle, that will be responsible for the increased lactic acidosis. So that means lactic acid, the production in the body, which happens because of the overactivity of muscles. When you think of all these, mobilization of fat, so as well as the mobilization of the nutrients in the muscle, that will be responsible for the abnormal increase of Vata Dosha in the body. So when you think about the relation between that, what actually happens in the body? First and foremost, because of the overactivity, so the person may have dehydration. And as the person is not taking any of the fluids, including the salts, etc., replacement, the person may have even electrolyte imbalance also in the form of sodium deficiency as well as potassium deficiency. And more blood supply to the musculoskeletal system may be taking place because of the overactivity of musculoskeletal system, which in turn resulting in the less blood supply to the alimentary canal. When there is less blood supply to the alimentary canal, naturally there will be less secretions may be there, less gastric secretions, less intestinal secretions, small intestinal secretions, large intestinal secretions will be less. Because of that, the person will be having less nutrient absorption from the alimentary canal. So that means because of the less gastric juice secretion or less intestinal juice secretion, whatever the macromolecules they are being consumed from an individual, they are not going to get converted into micromolecules. So that means that is responsible for the formation of ama only. And as because of the over exercise, first and foremost we are going to observe that is a shrinkage of a intravascular compartment. So that means more amount of fluid that is moving from intravascular compartment, blood vessels, to the muscles. Plus there will be less movement of the blood into the alimentary canal, leading to poor GI secretion, which is further leading to poor nutrient absorption. As because of poor digestion, there will be poor intestinal motility, which is considered to be because of the macromolecules. That means which is considered to be ama formation is going to take place. So take home message from today's discussion: whenever a person is doing excess amount of exercise, there will be carbohydrate and fat loss. When there is carbohydrate and fat loss, the next phase will be the person will be having metabolic acidosis, which may be in the form of ketoacidosis as well as the lactic acidosis. And because of this, more amount of the blood supply to the skeletal smooth muscle as well as cardiac muscles, the gastrointestinal tract will receive minimum blood supply. Maybe the oral cavity will be having the dryness of the mouth, etc. Stomach will be having the less gastric juice secretion. Small intestine as well as large intestine will be having the less secretions from those organs. And there will be shrinkage of intravascular compartment is going to take place. Next phase will be the person will be having electrolyte imbalance. Sodium as well as potassium ions deficiency will be there. And the last outcome is ama formation. This happens because of the poor conversion of macromolecules into micromolecules. So that's all for today. So, my dear friends, what are the major key takeaways from this particular today's video? Mention below in this comment as a comment. And what would you like to hear in the coming videos? Mention below. And if this particular video is giving you a new insight, then share it to maximum number of people, so that we can make a small message or convert the small message into movement, so that the people who are not the who are having the belief in Ayurveda, they will be having a even much more concrete belief. We can turn the Ayurveda learners as Ayurveda believers, so that they can practice Ayurveda in their life from the whole day or whole month or whole year or in their whole lifetime. Right? That's all for today. Thank you.